When you first look at someone, the brain perceives age, wellness, and fatigue based off of the aesthetics of the eye, which is why so many people get asked, are you tired? Even if they've gotten a good night rest, if there are signs of fatigue around the eyes, with dark pigmentation being the number one culprit. So in this video, we're going to talk about how to get rid of dark pigmentation underneath the eyes, because at some point, guys, everybody experiences some type of tired looking eyes or fatigue, especially if you are after the age of 30. But dark circles can come in lots of different sizes and shapes. There is not a one-size-fits-all approach to getting rid of dark circles because there's several different contributing factors. So we're going to go through different product recommendations, but we're also going to go through different lifestyle things that you can do, as well as in-office procedures that you can do. Again, guys, everything isn't going to work for everybody, and so I want you to figure out exactly what's causing your under eye dark circles. So we're going to start with a little test. So the eyelid stretch test can really give you a good direction as to what may be causing your under eye dark circles. Just a quick overview: the most common causes of under eye dark circles are either vascular changes, structural anatomical changes, or indeed pigmentation. So let's begin with the eyelid stretch test. So stretch the skin under your eyes in the direction of your cheek. If the dark color remains the same, it's most likely due to pigmentation. Or if you feel like the dark color just traveled downward, again, this is most likely due to pigmentation. If the color worsens, it's probably due to blood vessels or very thin skin. If with the eyelid stretch test, the dark circles improve drastically, this is most likely a structural or anatomical factor that is playing the most important role. This is also the type of pigmentation that gets better with bright lighting or with the application of cold compresses. And lifestyle and genetics can actually contribute to all of these. For anyone new here, hello, my name is Alexis. I am a board-certified dermatologist, and I have a clinic here in South Florida. My videos are all about educating you so that you can make the best skincare decisions. If that sounds good, please give this video a thumbs up and consider subscribing. Alright guys, so just some quick definitions. When I say pigmentation, I'm actually referring to a brownish hue that is underneath the eyes. When I say vascular, I'm actually referring to a bluish hue that you can find underneath the eyes, and this is usually due to thin skin. And when I say structural or anatomical change, I am talking about the hollowness or shadowing that actually can happen underneath the eyes. It's usually due to fat loss, fat herniation, weight loss, or the aging process. Before we go any further, let's address the question that some of you may have, which is, can I actually do anything about dark circles that are hereditary or due to genetics? Yes, of course you can. There are always things that you can do, even if you are predispositioned to something genetically, to help improve the chances that you don't actually develop the condition, or to make sure that you don't have any worsening of that type of condition. So yes, even if your dark circles are due to genetics, there is a solution for you as well. So my favorite topical ingredients for people who have dark under eye circles due to vascular reasons are going to be products that have ingredients like vitamin C, vitamin K, and retinol. Now for dark circles, that's actually due to hyperpigmentation, or pigment that's been tattooed into the skin. You're going to want to focus on topical lightening ingredients that not only stop overactive melanin, but also will decrease the amount of melanin that is being produced. So look for products that include ingredients like tranexamic acid, kojic acid, vitamin C, licorice root, alpha-arbutin, mandelic acid, retinaldehyde, or retinol esters. You don't want something too strong. Cysteamine, yes guys, I have the APC and I am reviewing it for you. My favorite kit for hyperpigmentation is indeed the Dr. V Hyperpigmentation Kit. Now for the structural or anatomical changes where we're talking about fat loss, herniation, or even just your underlying bone structure that causes hollowness and shadowing, this is when you want to use the under eye fillers. There is no cream that's going to be able to give you the desired results that you are looking for, especially not long term. I know there are some of those new argireline type of creams that give you the perfect eye in a couple of minutes. Now, truth be told, these types of creams are a bit of a Cinderella story, guys, because they will wear off after a while and you will return right back to how you were before. But it's a great option if you're not able to get fillers and you're looking for something to just make you feel a little more confident. Okay, so the indications for under eye fillers are definitely that sunken appearance that can happen underneath the eyes or the eye hollowness. Under eye fillers are not going to help your pigmentation or your vascular changes. So it's really important that you understand that and you talk to your doctor. So if you have a combination of different concerns, yes, under eye fillers will help with the structural ones, but they're not going to change your pigment and they're not going to change your vascularity. So while they can make a dramatic result for the right patient, it's super important to know exactly what you have that's causing your dark circles before you go spending your coins, or to be okay with the fact that this is only going to partially correct one of your concerns if you truly have a few different things going on. Now, puffy eyes may be from lifestyle, environmental factors, or even genetic structural factors. Because of fat displacement, it can actually make your eyes look puffy. If you have allergies, it can make your eyes look puffy from fluid, swelling, or edema that happens underneath the eyes. Or if you had too much salty food the night before, had a little too much fun with your alcohol, or you've been crying, all of these things can cause puffy eyes. So if you have any shadowing that's happening from puffy eyes, it's important to address those actual environmental or lifestyle factors that could be contributing. Now, while caffeine-containing products can help with under eye puffiness or with vasoconstriction, again, this is a bit of a temporary fix, but it's definitely something that can help you feel a little bit more confident as you go out in the day. Now, there is something called the nasal jugal fold or the NJ fold, which is basically the groove that separates the under eyelid from the cheek. As we get older, there's greater skin laxity that occurs between the heavy cheek muscles pulling down and the thinner skin around the eyes. So that skin laxity is something that we actually can improve by using products that help to increase the skin elastin and collagen, especially in this area. So let's talk protection, prevention, and concealing. One of the most important things you can do is actually choose the right sunscreen. Tinted sunscreen with zinc or titanium dioxide protects against the UVA and UVB plus the visible light, and it also masks discoloration and scatters light, which makes the orbital rim contours and hollowness or shadowing look less visible. Or you can choose mineral-based makeup with optical diffusers, but be careful not to be using a makeup that has some of those common culprits. One of my favorite procedures to do for under eye hyperpigmentation does include laser treatment because it can help with the blood vessels. It can help with the hyperpigmentation, and it can actually help with building collagen to support the structural changes that happen underneath the skin. But laser treatment is not right for everybody, so you definitely want to speak with your doctor about that. PRP or platelet-rich plasma is also a very good procedure to consider. This can be done with microneedling or in that little AquaGlow device. And you may even want to consider medical tattooing to help with the hyperpigmentation. Some of the lifestyle things that we do that actually contribute to our hyperpigmentation include forgetting to wear sunglasses when we're going outside. Make sure that there's good UVA and UVB coverage in your sunglasses. Also, of course, we need to be wearing our sunscreen, guys. Now, I know this can be really difficult to do because some of the sunscreen can actually burn or irritate the eyes. That is why I like to use a mineral-based stick. One of my favorites is actually this one here by Skin Better, because it gives me that full under eye coverage without causing any of the sunscreen to irritate or go into my eyes. And outside of the obvious like lack of sleep and dehydration, some of the things that we don't think about are the products that we put on and around our eyes. We can develop chronic irritation from products that we use around our eyes. This can be makeup, this can be eye creams. You really want to be careful about the different ingredients that you're putting around your eyes. Even if you've been using that product for years, you can still develop an irritation to it later. A common culprit that I see in the office is actually the topical compounds that people put on for their eyelashes. A lot of those ingredients can actually lead to hyperpigmentation or darkening underneath the eyes. So you want to be careful about the different eyelash growth serums that you choose. A lot of people actually do not realize how much they rub their eyes, especially in my contact wearers or people with allergies. So there's this little line that develops on the nose when you have allergies. It's a good sign of allergic rhinitis. It's a dark line that appears here. That same line can appear underneath your eyes, it's a whole area of hyperpigmentation from chronic rubbing. So if you're someone who is now going to be noticing how much you're rubbing your eyes, that may be contributing to your hyperpigmentation as well. So just be cognizant of how much you rub. This was my most highly requested video by you guys. I hope I delivered on what you were looking for. If so, please give it a thumbs up and let me know what you want to see next. Until next time, guys, be well.